Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today my topic of discussion is about multifocal choroiditis, its different investigations, images, and management. This is a fundus photograph of a patient suffering from multifocal choroiditis. Multifocal choroiditis is basically an inflammatory disease in which retinal pigment epithelium and choroidal vasculature is involved. The patient presents with decreased vision, blurring, and if you do examine, you will find such types of lesions, yellow lesions, and the size range usually goes up to 250 micrometer to 350 micrometer sometimes. And they are basically isolated lesions occupying the retina, and their margins are blurred in active conditions over there. So this photograph basically two slides showing us the patient with active disease of multifocal choroiditis, different patches occupying the different areas of the retina. I mentioned this disease is basically affecting the retinal pigment epithelium and the capillaries in the choroid. So here again we are showing you different patches, the lesion over there yellow colored with indistinct margins in the right eye, occupying the macular area, as well as it is on the nasal side of the retina. Patients usually present to you with floaters, mild discomfort, decreased vision, and scotomas. So usually these are the presentation features over there. So in this slide, we have used the wide field optos camera, and you can see all the lesions over there in the macular area, and they are also occupying the nasal side of the retina. These all are active lesions, yellow lesions, round. And the thing is, autofluorescence is also very helpful in diagnosing these things. Yes, in active lesions, we will find moderate hyperautofluorescence as shown in these photographs. Right side, you can see that the posterior pole, especially in the macular area and the nasal to disc, you will find there the activity. But when these get treated and they become atrophic, then there is hypoautofluorescence. So this is an active disease, and autofluorescence has a very beneficial role because sometimes the lesions which we cannot see, we can find out this autofluorescence. So it is very beneficial. Another fundus fluorescein angiography, multiple lesions of multifocal choroiditis with progressive hyperfluorescence throughout these areas. Yes, different phases, you can appreciate how they are getting hyperfluorescent, different areas are involved in this. Another fundus fluorescein angiography, multiple lesions of multifocal choroiditis with progressive hyperfluorescence throughout these areas. Yes, different phases, you can appreciate how they are getting hyperfluorescent, different areas are involved in this. Another FFA, here you can see in the right side, this time the hyperfluorescence progressive along the supratemporal arcade, more pronounced. And even in the left, you can also see over there the patches of hyperfluorescence. Another FFA, here you can see in the right side, this time the hyperfluorescence progressive along the supratemporal arcade, more pronounced. And even in the left, you can also see over there the patches of hyperfluorescence. Talk about OCT. It has got also a very beneficial role in the treatment. It shows us macular edema. It shows us the involvement of different layers, choriocapillaris, RPE, all these things. But in this particular patient, there was no macular edema. Usually macular edema is there in these patients. These patients develop choroidal neovascularization, all these things. And once the macular edema, this is a very indication that treatment should be started in these patients. But surprisingly, this patient, the images, you will not find any macular edema. Differential diagnosis, there are many things. Apart from taking a proper history of the patient, we have to go for blood works, investigations. Yes, Earlier we discussed the images, fundus fluorescein, angiography, autofluorescence, role of OCT. Even OCTA is very helpful, as I mentioned in my previous presentations. The choroidal neovascularization, blood vessels over there can be localized. All these things, imaging is very helpful, but we have to go for the investigation blood works also. So apart from the basic routine blood work, CBCs, and renal and liver profiles, we should also go for the tuberculosis PPD test, skin test. It should be done, measurement should be done after 48 and 72 hours. Quantiferon tuberculosis is very important. For syphilis, we have to do VDRL, we have to do RPR test, and then along with that we have to keep non-infectious causes, as I mentioned, sarcoidosis. These patients may have punctate inner choroidopathies, so sometimes lymphomas, metastasis, all these things can manifest, and these should be kept in mind when treating these patients, and blood work should be ordered. So the most common things which lead to decreased vision as an ophthalmologist we have to take care of, as I mentioned, is the macular edema. Yes, these patients can develop macular edema, choroidal neovascularization, they can have epiretinal membranes, and they can have optic neuropathies. Yes, so we had the mainstay of the treatment usually in multifocal choroiditis is, of course, the steroids. Yes, oral steroids have to be given to control the acute inflammation. And sometimes we have to take the help of the immunosuppressants. Yes, and if there is a choroidal neovascularization at any stage, we have to use the intravitreal anti-VEGFs. So all these things are used to control the local problems over there. But if the patient is having tuberculosis along with that, then we have to consider about the role of anti-tuberculous therapy to control active tuberculosis, which is causing all these lesions. So that's why the blood works and those investigations are very important to be done in these patients. Respected audience, today multifocal choroiditis was our topic of discussion. Its diagnostic features on images and blood works and what management we can do for this. I hope this will be beneficial in your clinical practice. I want to thank you for your attendance and attention. Thank you.